Hi, everyone. Welcome back to part 2 of our conversation with our amazing speaker on the Do the Change podcast. We're going to jump right back into the conversation. Don't forget to subscribe to our YouTube and follow us on Spotify and Instagram at Do the Change Podcast. Let me ask you another question. It's like slightly a bit of a change from what we were talking about. So could you share a personal story of a significant challenge or setback you faced in your career and like how you managed to overcome it?
Yeah. Um, yeah, it's a good question. I think, I guess this is a valley fever example. I think, yeah, valley fever is somewhat of somewhat rare disease, is more prominent in the very endemic regions, but I think one of the biggest challenges that I've faced is that there aren't great interventions against valley fever. Um, and like I think the best thing is for people to wear N95 masks to prevent spore inhalation, but I think we saw with COVID, it's hard to get people to wear masks. And even for, COVID, where I think it's like a disease that is infecting a lot of people for like rarer disease, it's even harder to get people to wear masks. And particularly, I think outdoor workers where it's hot and you don't want to wear a mask, which I completely understand. Um, but that is kind of our best prevention measure. And other than that, there's some things you can do, like it's carried in dust, so all the dust suppression measures help. Um, but yeah, like wetting the soil, putting tarps down, that kind of thing help. But it's been hard to, I guess, for example, like last year, we saw that where we expected there to be a big increase in cases, but there was only so much we could do. We could like warn the public and warn physicians that it's going to be cases, but there was not a ton we could do in terms of actually preventing people rather than just warning them to, avoid dust exposure. So there is like a vaccine in development that I think is hopefully close, but in the meantime, I think there aren't a lot of ways to prevent people from getting infected. So that's been a challenge when I'm not necessarily working in a prevention space and just, developing ways to prevent people. I'm like looking at how climate is influencing disease patterns. And so when I find a result, I can say, okay, well, this is the way the climate is impacting the disease, and this is what we may expect to see in the future or in the next year, in the next 20 years. But then what? Like then how do we stop that from happening if they're going to be increases? So um yeah, that's been a challenge.
I see. Yeah. And it's also sad to like see the numbers despite your efforts, right?
Yeah, totally. I mean, yeah, it is. It's on the rise, and we're seeing a lot more cases every year. And so yeah, it's, I guess, yeah, like last year was an example where we saw a huge spike in cases, and despite our efforts of trying to warn people, and maybe there would have been more cases if we didn't do that. Um, but maybe there was also more awareness among physicians, so they were testing more and detecting more cases. So it's a combination of things, and you know, hopefully we're having an impact and at least preventing some people from getting sick.
Yeah, yeah. At this point, all you can do is just like continue chugging along, right?
Yeah, or I think at least I'm trying to do some work that can be nail down. I think we don't have a great idea of where people are exposed. So I think like more work is going into trying to kind of pinpoint points of exposure. And, we think, well, there's a lot of people exposed through work. And so, understanding what kind of job activities put people at risk and that kind of thing, we can maybe tailor some modify those tasks or tailor some interventions to prevent, specific, tasks, jobs for people from
Yeah.
getting affected.
Does this aspect of your research like involve going to these people's like places of work and like asking them, surveying them?
No, sadly. No, I think that would be really great. But there have been a few studies out there, not that I have been on occupation. There was one that was looking at workers' compensation claims, where they looked at, just among occupational categories, who was filing more claims for valley fever. And that was, I think, pretty high amongst construction workers and agricultural workers, and oil and gas workers was pretty high, which are all, occupations that I would think would be high. So that tracks. And then there was an effort from some folks at UC Davis who went to an agricultural site and were looking at specifically what activities those workers were doing, and then which ones got sick and which ones didn't, or got valley fever. And their results made a lot of sense. They found that the workers who were actually like digging in the soil and they were working with like root and bulb vegetables, had a higher risk of infection. And then people who are like doing like leaf pruning from trees had a lower risk, which makes sense if they're farther away from the ground and dust, then they would have a lower risk. But from what I've seen, there's only been that one effort to kind of look at specific occupational tasks.
I see. So the field is ever growing.
Yeah, there's lots more that needs to be done.
Okay, in that case, let me ask you another question that kind of turns away from what we were currently talking about, unless you have more you'd like to okay.
Pivot, yeah.
Okay. So, what is one piece of advice you wish someone had given you, like when you were starting your journey in occupational and environmental health?
Oh boy. Advice. I would have given myself so much advice. I think something that one of my lab mates recently told me that I really resonated with me, and I think like, I don't know, I've been repeating it a lot recently, and I would have repeated it to myself back then too. She said that she, like her, I guess, way of operating in terms of projects she wants to work on is that she does the things that set her soul on fire. And I really liked that because I think it doesn't necessarily need to be like a giant fire, or I think it like can be the range of just a small flame to a conflagration, but or conflagration. But I think like things that excite you, things that make you want to work and want to, be out there and doing the work, and kind of, yeah, motivate you, I guess, is similar to it. But yeah, I would tell myself to pursue the things that set my soul on fire.
That's awesome. And it's actually how you found the field in the first place, right? Going back to our,
maybe I didn't need to tell myself that. I already was doing that, but
yeah, you should give your undergraduate self a little bit more credit for that.
yeah. I guess I would also, I think, tell myself that it's really important to have things that bring fulfillment outside of school and research, to be kind of a more balanced person as a whole. I think that, so I don't know, the Berkeley undergraduate experience maybe like breeds a lot of people who are like workaholics and feel like they need to work all the time and compete, and I think that can have the impact of, putting a lot of your self-worth on how you perform academically or in your career. But I think that it's super important to have lots of things outside of school that bring you fulfillment, so that when you hit a setback in one part of your life, that there are other parts that are there to brace that or cushion that setback.
That's awesome advice. I think that's a very pertinent topic for Berkeley undergrads.
Yeah. I mean, I think I was not very good about it back then. I think I've gotten a lot better, but
Yeah. What changes did you like implement in your life to improve at that?
I think maybe it's just been a gradual change. I think like prioritizing, um, like, I don't know, I think like personally, I like to run, and so like I have, you know, made running a priority at sometimes, and just like staying healthy and active, and that's been done wonders for like my mental health, and also just to like have something that I care about that's not school. And so if I, get injured from running, then I can like brace that kind of setback with like spending more time working on research or other things, that kind of vice versa. Um, but also I think I like having like a good community and friends and a support system um, is important, and like I think is also something that takes work, I guess. I don't, maybe it doesn't seem like that, but it's like I think that you can put more effort into you, the general you, I guess, to you can put more or less effort into cultivating community and friendships and things. Um, and so yeah, balancing that with, everything else is, I don't know, something that I've tried to do a better job with.
Yeah. What's advice I should take for myself? Okay. In that case, is there so since we just did advice for like balancing your own like life versus academic life, do you have any advice for those who are like entering the professional field?
Like the EHS
Mm-hmm.
health field. Ooh, it's a good question. I mean, it's tough because it's such a big field and such an interdisciplinary field where, folks are working on such different things. Um, I think that, well, there are so many things, so many different aspects to this question. Uh, I think that it's important. I don't know. I guess a couple of things. I think it's important to stay connected to the like I guess the experience of the thing you're working on, like the people who, in my case, like the stories of the people who are getting valley fever and how their lives are impacted. I think in my case, I would, do a lot of data analysis and I'm in the lab, and I think could be easy to forget that like these numbers are people. And I think it's really important to stay connected to that, and it's also good motivation for like to keep doing what you're doing, because it is important. It does impact these people's lives, and um, you can have an impact on their life. Um, I think also I think it's important to, I guess generally this maybe goes beyond just our field, but um, it's really important to have like a growth mindset. I think that's like everyone is always growing and can be better, and um, as you like, there's always going to be somebody in the world who knows more about something than you, and so having that, or I guess understanding that, and like being open to making mistakes and growing and doing better is really important. Mm.
Mhm. Seems like a key theme is kind of like forgiving yourself for not having like the most knowledge in the field or like the best academic performance, and making sure you have other things to um to fulfill yourself in ways that the academic or professional field cannot.
Yeah, I guess so.
Mhm.
Yeah.
Those are all good like mental health caring tips.
Yeah. Yeah, be nice to yourself.
Yeah.
Lift each other up.
Easy advice to like forget.
Yeah, yeah. I think maybe, I don't know. I'm sure some people are better about remembering.
Yeah. Yeah, that's
Maybe
true. That's
that
true.
fits in with what I was just saying.
Yeah, it does. So, then I guess another question for new professionals, which it would be, or sorry, let me ask you, in your opinion, what are some of the key skills or qualities that you think are required to succeed in like your field?
Ooh, qualities or skills. I mean, I think that what I do is very quantitative. And so I think that like knowing, like having quantitative skills and coding skills are important things. That said, like that's just me. And I think there are a lot of people in the like environmental health sciences who do things that are less quantitative. And so those skills maybe aren't as necessary. Um, so yeah, I guess it really depends on what you're doing. And um yeah, the skills that are important are going to vary so much based on your specific field. Um, and those you'll develop those over time. I think that those are kind of maybe the like hard skills. I think there are a lot of soft skills that are important. Um, like the growth mindset, I guess, which I mentioned. Um, and just like being empathetic is a soft skill that is not always there in like the academic world. Uh,
Hmm.
and I think, especially when you work on something that's health related, I think it's really good to have empathy for others, and particularly those impacted by what you're working on. Um, but
Yeah.
yeah, yeah,
That's true. I also feel, correct me if you think differently, but I feel like those people who are already inclined to have certain skills and certain qualities will kind of naturally find their way to a role that kind of takes advantage of those skills and qualities.
yeah, yeah, definitely, definitely. I will say actually one thing I think a good skill that I've seen is, or that is important, is science communication.
Oh, yes.
Like that is something that I am like practicing and trying to work on. And but yeah, being able to communicate your results effectively is something that is can be really challenging. And in a way, yeah, I think communicating, knowing how to make things resonate and understandable and impactful, but also kind of concise, um, I think is really important. And can be the difference between, somebody listening to you talk about your research and forgetting it instantly, or like actually, remembering what you do and why it's important, and what's going on. Um, so I think, yeah, science communication.
Yeah, that's a good one. That's one that's like, I think as for me, I'm just starting out my own scientific professional career, right? That seems to be like the key one that all my mentors are telling me to work on like the most, work on first.
Oh yeah, yeah.
Yeah.
Well, it's a like a ever progressing progress. Like I think, or process. Like I think I'm still working on it. I think a lot of people I know are still working on it. So it's
Hmm.
continually to continue to improve.
So you've mentioned a lot of times of like all the different skills and things that you're currently working towards. Do you have so I wanted to ask you if you have any like large goals that you're currently working on now? Any
Ooh,
perhaps ultimate goal?
ultimate goal in terms of, I guess, like research or
Anything? Maybe even like not an ultimate goal, like a medium goal.
wow, big goals. Um, I think, wow, ultimate goal. I think there are so many like small goals that we work towards every day. And even like if those are medium sized, like, there are research projects that I'm working on that I'm excited about and are medium goals of mine. Um, but I guess in terms of like big goals, I think a big goal of mine is to have an impact, I guess, which maybe sounds um like everyone's goal. Uh,
No, no,
but
not at all, not at all.
but yeah, I think sometimes working in academia, you're removed from the impact a bit. Um, and you work on papers that get published, and it's hard to, maybe they do have an impact, but you're many steps removed from that impact. Where, yeah, I think I would hope in that case that I'm having an impact. But I would like to do some research that is more directly impactful, maybe, um, and then kind of experience that, um, you know, that is impacting people, and hopefully improving their life. Um, so yeah, I think, yeah, a lot of my goals I think are related to like other people in my in my life. Like I feel that I get a lot of fulfillment and gratitude, um, or yeah, fulfillment out of supporting other people, and like I'm sometimes more excited to help with other people's projects than work on my projects. So I want to see them succeed is a goal of mine.
Uh-huh. That's awesome. That's really wholesome. I think this might be an occupational hazard of being in public health.
Yeah, yeah. That's a good thing though. Maybe not a hazard.
Yeah, it's a occupational benefit.
Yeah, yeah.
Work bonus. Yeah. Mm, let me see. I'm trying to think of any other questions I want to ask you that I might have forgotten earlier. Do you have anything that you want to say that you forgot earlier?
Mm, I guess as if this is a venue for public awareness about valley fever, I we we think that there are going to be a lot of cases again. We saw a really wet winter this past winter in California, and so we think that there will be a dry summer, and so we're expecting to see a lot of cases in the fall. So people in California who are listening, don't beware of dust exposure this summer and fall. Try to limit your exposure to soil and dust.
How does this like impact people who aren't working with soil and dust like on a regular basis? Like, will it still impact the regular person, you think?
Yeah, yeah. So not every case is acquired from your occupation. And we actually, I think, I don't know. I don't know how many cases are from occupational um, activities, but there are a lot of cases of people just like living in areas where it's dusty and getting sick. And so um, everyone is at risk. There are stories of people driving down I-5 through California, and their windows were up, but they're like this dust came in through the vents, and like they got sick. So it's can
That's
really
crazy.
happen in so many different ways. So you kind of just want to limit your dust
Hmm.
exposure. Make sure if you're driving through a dust storm, close the recirculation bar on your in your car.
Hmm. Yeah. What places are most likely to get valley fever?
So in California, so the cases are really high in Arizona and California, particularly in California in deep rise in cases outside of that area. So those areas are still risky, but we're seeing increases along the coast. So like San Luis Obispo County, and Monterey County, kind of northern in the Central Valley, like where Sacramento is, and the counties around there. So it's expanding.
Mm,
So
that's scary.
yes, hopefully we can do something about it.
So those who are living in those cities, like watch out for dust, watch out for dirt.
Careful about dust.
When it's windy, would you say like there's a higher incidence?
Yeah, we don't know for sure research
Uh,
wise,
uh,
but there was a recent study from Arizona that found that on windy days they found the fungus in the air more often. And so we think that wind is probably important. I would guess because typically with higher winds there's more dust. So um that would be, just dust is the main thing we worry about. But also,
mhm.
who are directly in the soil too are really at high risk.
Yeah, I see. Okay, PSA to those out there, spread the
Yeah,
word to your
yeah,
friends.
careful.
In that case, I think I'm out of questions for you, and you got in your last thoughts, right?
I think so.
Okay. I found your advice really helpful. Like I'm gonna have to sit down and like ponder those things that you said about having another hobby to find fulfillment when academic things don't fulfill me.
Yeah.
Like I think I gotta start working on that.
Well, it's never too late. Uh,
hmm
yeah.
I think I need
I
to spread this to my roommates too, all my pre-med friends.
yeah. I did notice actually one question that you had sent me was um about like where I see the field going or something
Oh,
about
yes.
how like we can improve the the field. And
hmm
I think we don't have great collection of like occupation data. Like I think we don't really know much about like, what occupations people work. I think
hmm
there are so many variables that we consider in terms of like the social determinants of health, like your socioeconomic status or your like race, ethnicity, experience, like so many things that are routinely collected. If you go to the doctor, they like note these things down. But occupation is like such a big determinant of health, not just valley fever, but like so many other things. Because you spend so much of your time working in your life. But we don't have like great collection of that data. So I feel like we need more systematic collection. Like I personally
I
feel like it should
see.
just be a part of like the medical record. Like you should just write down like what the person does for a living, and then there would just be better data, and we would have a better understanding of like what people are at risk for. Um,
Yeah,
so
this is really interesting. I've never thought about that before, but like I totally agree.
thanks. Yeah, I don't know. It would be so great. I'm sure there's like so many administrative barriers to bureaucracy to getting occupation as a required thing in health records, but it would be great. And I think we could learn
hmm
a lot and improve health.
Do you think the main way would just be through health records, or like where else? How would you like propose collecting this data, and where would it be like stored?
Yeah, I mean, I think personally, I think health records would be great. Like I'm sure you would undercount people who like don't have health insurance or like don't seek care. Um, and it would be great to, get occupation data on everyone. That makes maybe unrealistic. I mean, we do it through the census, but um, the census has like very specific occupational categories that you have to put yourself in that maybe don't represent like I don't know. I would if I was like I would probably put something like professional or technical occupations or maybe if so like education. But that with either of those specifications, you're not going to know that I'm like out sampling the soil and I'm at risk for valley fever. Like
That's
there's
true.
just like a larger group that can get conflated. So um I feel like medical records would be um the best way to do it, but I don't know.
Yeah,
Others out there
and that
listening to better ideas that I'm very open to hearing it.
and that opened the doors for a lot more like population research. Yeah, that's a
Yeah.
good idea. Cool. So that's a possible, hopeful future advancement for OEHS.
Yeah, I that would be amazing. And everybody in the occupational health world would love that. It's just a hard to make happen.
Hopefully we see it in our lifetime. We'll see.
Yeah, I hope so.
Well, I really enjoyed talking to you, Simon.
Thanks, likewise.
Yeah, I think this episode was full of a lot of good advice, especially to
Oh.
like people like me. That's awesome.
Well, yeah, I hope that it's resonates with people out there. And I'm just one person, so ask other people for advice too. If mine doesn't
Uh-huh.
resonate with you, but yeah.
What was the phrase that your friend said to you earlier? Do what lights your heart on fire?
Yeah, do the things that set your soul on fire.
Set your soul on fire. That's better. Yes. I think that's like the phrase for this episode.
Yeah, yeah. If there's one takeaway, it should be.
Yeah. Okay. Well, thank you so much for joining us today, Simon.
Thank you.
I
Yeah.
had a great time talking to you. And yeah, I wish you luck in all your valley fever research.
Oh, thank you so much. I really appreciate it. And look forward to listening to future episodes with some other folks.
Thank you. Thank you. Okay. In that case, thank you. I'll talk to you hopefully soon.
Sounds good. Thanks.
Yeah. Thank you. Bye-bye.